A little bit of background about myself. I was born in Romania and then moved to Ohio and spent my summers going back and forth between family and Paris. Then I attended Princeton University for my undergrad, spent time doing research at Harvard, and then subsequently went to UPenn for both my MD as well as my PhD. I stayed there for my residency training, and I've stayed there as faculty. And really my interests, both clinically and in my research lab, are to prevent and treat aging. And specifically, I look at the genetic causes of aging in our patients' tissues in my lab. And then clinically, I focus on the prevention and treatment of aging, both from a skincare standpoint as well as a surgical standpoint. And I work on both the face as well as the body. Today, I'll mostly focus on the face since this is a more skincare-related talk, but I'm happy to answer any questions about any of these components. So just a little bit about our resources. We have 12 plastic surgeons currently in our practice. All of the surgeons focus on aesthetic or reconstructive surgeries. I do a little bit of both, but I would say 80 to 90% of what I do is aesthetic. We have very specialized plastic surgery nurses, medical assistants, and administrative staff. We operate at least 6 different hospitals and multiple surgical centers. And of course, because we're a large multidisciplinary academic center, we have a lot of resources at our hands, and we work with other specialties quite frequently. In terms of our skincare program, we have a very extensive one and much larger than any other department. We have 2 medical estheticians. Jean is here tonight. Wave, Jean. And Amy, who's our second esthetician. Basically, a medical esthetician is not like somebody you would normally see in a medi-spa or one of your local salons. They're medically trained. They're able to do treatments that are at a higher efficacy, really medical grade treatments, because they do it under our tutelage. We also have a brand new micropigmentation artist who's back there, Mandy, wave. We're very excited to have her on board. She just started this week, and she's really an artist, and what she does is, as I'll show later, she does permanent tattooing for both reconstructive, so both for, let's say, post-breast cancer, nipple areola tattooing, as well as cosmetic tattooing of the brows, eyeliner, etc. We also have a large staff. Wadia, who's my assistant, who's back there, please wave. She's excellent, and not only does she help me with all my surgical administration, but also she's been very involved in skincare and is going to become even more so. Rose, Linda, and Tracy, those are just some of the people that we have. We see patients both downtown, and that's in our brand new building. I don't know how many of you have been down there. It's really beautiful. We've been there a couple of years in the Perlman Center. And then also we see patients here several days a week. So really the goals of what I do as both a surgeon, a mother, a wife, and a scientist is I like to connect with the patients. I like to educate and really recognize that, at least for women, they're so busy caring for others that they often neglect their own healthcare needs. They also tend to feel guilty about wanting to improve their appearance, especially right after childbearing. Actually, that's probably the most common time, not so much as you get later into life. And then also recognizing that men also want to look and feel good too, but they're very self-conscious and often need the support of a wife or a girlfriend or a child to really steer them in the direction that they want to be, because they're a little bit embarrassed about wanting to feel and look good. And really what I want to focus on is that good skin and body habits should be established early in life. So for some of us, they would be in our daughters or our sons. So the problem that we try to address is aging, and aging of the face, the body, as well as the mind from the inside out. And one of the other problems we really face is the hype that's come about with the popularity of plastic surgery. As you can see from all of these images, there's been a lot out in the news, and you hear about these kinds of interventions all the time. And unfortunately, most of what the lay people see are the negative aspects of plastic surgery, because the positive ones or the surgical interventions that are so natural that you wouldn't notice a difference, you're not going to see those. You shouldn't be seeing those because they do look natural. So the only ones that are really featured in these types of media presentations are the ones that are a little bit shocking. And so I see it as one of my jobs to really educate people about what we do and why it's okay. And really, most people want to look a little bit more refreshed and look as good as they feel and just look a little bit more natural. And all of these are women that we can all recognize, and they're all in their 40s or older. And this is an article that came out saying, is over 50 the new sexy? And you can see from these women who are in their 50s, 60s, and 70s that people really want to continue their prime into those years, and why not? They've worked hard their whole life. They take care of their bodies. There's no reason they shouldn't look as good as they feel. So this is a pyramid of all the tools that we have at our disposal, and I call it our anti-aging pyramid, with the most common treatments at the bottom here as lifestyle aids, the topical treatments that are a little more involved, such as injectables that you can have at dermatologists and med-spa, some internists even, and then the most invasive, or the top of the pyramid, the surgical interventions. And we as plastic surgeons really are trained to have access to all of these things from the bottom of the pyramid up, and then from the top down, as you get somebody to go from this early intervention all the way up to surgery, and then once they've had surgery, what you want to do is maintain them and go to lighter treatments. So what we feel as surgeons is that we really provide the best solutions to anti-aging because we understand all the components of a youthful face and body. And that's because we know the anatomy and the physiology from the top down, from the head to our feet, and also from the inside out, from our bony structure, for our soft tissues, as well as the skin. And this is just as an example of one part of our body that ages, in the face, and that we can all recognize. And as you can see, perhaps from this picture, although this is an idealized picture, nobody really looks like this, you lose bony volume, especially in the cheeks, the chin area, the maxilla area. You tend to get the sunken face look with time. You lose fat volume. You lose fat in the face as you age, whereas you gain it in places such as the abdomen or the buttocks. That's not what we really want, and that's one of the things that I actually study in my lab. The connective tissues become loose. That is what we call radial expansion, and that is the connective tissues that connect your soft tissue, so your fat, your skin, to your skeleton. They become loose, so the elasticity goes down, and so everything just sort of hangs off your skeleton as opposed to sticking nice and tight. And as you can, if you think of babies, they have a lot of fat, or youthful kids, they have a lot of fat. They have folds, that's normal, but they also have this ability to keep their tissues stuck to their skeleton that we, as we aged, don't really have the ability to do. And another foe for us is the gravity that tends to cause our tissues to descend, and these are most commonly manifested as the formation of jowls. And then, of course, your skin suffers too. You get decreased collagen, you get a decreased elastin, wrinkle formation. A lot of people get hyperpigmentation from exposure to the sun. And then overall, you just get decreased cell turnover. So what we do is really ask every time we see a patient, where is this patient in the aging process? And so are they a candidate for skin care and prevention? Are they a candidate for injectables? Are they a candidate for laser? Are they a candidate for surgery? And what we really try to do is prevent, treat, and maintain, and then go back again. Once you've had an intervention, you want to prevent the next sign of aging from happening. And what we believe, at least as plastic surgeons, is that continuity of care is critical, and that the best results are really achieved when a patient can be treated in a longitudinal manner, either from an early age, whether it's a teenager who comes to see you for acne, that you're treating their acne, you're teaching them about sun prevention. And they may come in a little bit later. Once they've aged, they've gone through college, they're early in their career, they may need a little Botox. And then down the line, if they want a mommy makeover 10, 15 years after they've had their kids and they're ready to return to a life outside of their children. So let's talk a little bit about these 4 areas, and I'm going to discuss them from top to bottom, from least invasive to most invasive. So what can we actually treat effectively with skincare alone? Well, we can treat fine lines, wrinkles, laxity, that means a little bit of loose skin, not the kind of loose skin that really requires a facelift, but the earlier signs of laxity. We can treat acne, we can treat melasma, and that's the hyperpigmentation that happens, the brown spots that happen with pregnancy or oral contraceptives, sun exposure, etc. We can treat rosacea, which is the redness that happens around the same area, around the nose, the cheeks, spider veins that happen on the face or other parts of the body, dull or combination skin, sunspots, and then any unwanted face and body hair. And how do we actually treat these problems? Well, we have a variety of tools at our disposal. We use chemical peels a lot. People tend not to like the term chemical peels because it sounds artificial and very stringent. However, these peels are acid-based, and they're all natural alpha hydroxy acids. They're fruit-derived acids. They're basically just stronger versions of if you were to take a fruit and rub it on your face, but except these are actually effective because they're at a higher concentration. We do things such as microskin resurfacing, which is a version of microdermabrasion, but the next generation, which is much more mild, but much more effective. And I'll talk about that a little bit later. Dermaplaning, another way to resurface the skin. We use IPL, or intense pulse light, to get rid of sunspots. These are various tools with different types of lasers and light therapy-based laser hair removal, and then, as I mentioned, the cosmetic tattooing. And then one of my all-time favorites, lash lengthening agent called Latisse, which I really didn't believe in when I started all of this, but as I grew through the practice and I tried it myself, I've become a believer, and a lot of my patients have taught me why it's so important to use it as you age because of your eyes, and I'll discuss that. So what happens if you come see us for skincare? Well, typically you'll see either Jean or Amy for an initial consultation. You have a lengthy discussion about what's appropriate for you, both from a financial standpoint, a recovery standpoint, time-wise, and you come up with a treatment plan. You get follow-up meticulously to make sure that you're recovering from that peel, that you're recovering from the summer and having been exposed to the sun, etc. We have all medical grade, effective, trusted products that we all try ahead of time. We have lots of seasonal bonuses, lots of specials, as you probably saw today if you picked up the sheet. We also have access to the clinical trials of the newest treatments. And so this is a picture of what can be achieved with Latisse, and these are not touched pictures, but Latisse is the only FDA-approved agent to grow eyelashes fuller, longer, and darker, and you can see from day 1 to day 16. And these are pictures from the company, but what really convinced me was when I was doing Botox on a patient and I was looking at her from the top down, I couldn't stop but stare at her eyelashes. And I said, wow, your eyelashes are really amazing. What kind of mascara do you wear? And she's like, well, I use Latisse, it's not the mascara. And so she really was the first people to point that out to me, and she's had amazing results, as have most of us in the practice who use it. And the reason it's important is not so much because eyelashes are another thing that you can treat on your face, but as you age, the aperture or the opening of your eye gets smaller. And so what happens is that tends to be consistent with an aged look, and people tend to compensate for that by adding more and more makeup. Well, that just tends to make you look more and more aged. So the best way to do it, and you can see that this is why false lashes are so popular, at least among the media, is that if your lashes grow, it really helps to open up the eye more. So it looks more youthful, it looks more rejuvenated, you use less makeup, you use less mascara, and so in the end it's really a benefit, not only from a cost standpoint, but also from a rejuvenative standpoint. So this is a picture of before and after glytone peels using glycolic acids. in a range from 30 to 70%, and of course this is after 45 days of frequent treatments. But you can see, and this is actually not even one of the more powerful peels that we use, but you can see an improvement even in these early pictures. Another picture of aging of the neck before and after peels. We have also peels that make your skin much more even-toned, and they're very, very effective. So everybody asks me when I give this lecture, what's the basic skincare plan that I recommend? You always need some kind of a gentle cleanser, preferably something soap-free so it's not really drying. An exfoliating scrub of some sort. By that I mean the ones that have the little grounds in them. And that you use in the shower, because all of the agents that are very active are going to make you peel, and that's the goal of them. They stimulate cell turnover, and they get rid of that top layer of skin, and so you're going to need some kind of a scrub to get rid of that. Really, the best agent that we have against aging is retinoic acid, and that's Retin A. Not everybody can tolerate it. I like certain formulations that I think are much more tolerable and much more effective. The one I like is called Avage. People who really can't tolerate the prescription strength, we have slightly less active agents called Retrinol or Retinol, and those we have a variety of different types. What you also need to incorporate into your regimen is vitamin C and E serum. That helps with not only sunspots as well as prevention of free radical species from attacking your skin during the course of the day. And then those two things in combination with some kind of an acid, depending on your skin type, a glycolic, a lactic, a salicylic, a TCA. And so it's really these three agents used all together, and the retinoic acids you use at night only because they make you sun sensitive, and these two you use during the day. These are the most important things. If you had to spend a certain amount, I would say the cleanser and the exfoliator you can get at CVS if that's what you have to do, but those three types of agents, I want you to buy high quality, really effective things, otherwise you're not going to get a result. And then at the bottom, everybody needs sunscreen. A lot of people are not well informed about what's the best way to use it. It's not the amount of SPF that's in it. As long as you're 30 or above, you're fine, because that gets broken down as soon as it's exposed to the sun. That only protects against UVB rays. Those are the ones that cause your sunburn or your skin to get red, but that's not what causes the true damage, the deeper damage, and those are UVA rays. And to protect against those, you need not a chemical screen, but actually a physical screen, so mineral oxide, titanium oxide, copper oxide, zinc oxide. And so you need the combination of the two active agents, and you need to reapply it every 2 to 3 hours. And that's what people think. They think in the morning that if they put it on, they're protected for the day. And that's why everybody comes to us and says, but I wear sunblock. Well, but you don't wear it correctly. And then, of course, all of these agents work much better if you're actually getting regular peels that allow that top layer of skin to slough off, because that way they can actually have more access to that active layer of skin. And then Latisse we already spoke about. That's what it comes in. But this is the little bottle, and then these are the brushes that we were talking about. Each bottle comes with like 120 brushes, two months supply, one for each eye. So I wanted to tell you about what's new with our skincare program. We have a variety of new things that we're very excited. We've just introduced all of these really, over the last few weeks. We have two new skincare lines. One is called ASAP. It's actually the most popular medical grade skincare line in Australia. And it's brand new to the US, and we've trialed it. We really like it. It's less pricey than a lot of our other lines, while being just as elegant and just as effective. It also has a really nice line for body products that we enjoy, and so it's very, I think it'll be very popular, especially for people who want to be very cost conscious. The second one is Neo Cutest. It's actually a Swiss line that is formulated, or the line is based on this PSP, or processed specialized cellular proteins that they basically got from babies or neonates. It's basically these growth factors and other molecules that they think are very active to rejuvenate the skin. And so this is a much more scientifically based line. It's much more potent. It's a little bit the competitor of TNS essential serum, although based on a different technology. I don't know how many of you are familiar with that. So this is a much more active line, I would say, for people who have higher levels of aging. But I think we'll do very, very well because it is actually very effective. We also have a whole new set of peels, the ones that I told you about from Italy. The Enerpeel technology is one where you can have a much higher acid content, a much greater effect, but less downtime and less side effects. And it's because of this technology that allows the peel to penetrate more deeply without damaging the skin. And so we're probably the first to have these, and these are based on pyruvic acid, mandelic acid. So pyruvic is really for bad acne, thick, sebaceous skin. Mandelic is for rosacea, and then the TCA, which is excellent for all aging. There's a low 25% and a 40%, and there's a whole other range of products that are coming out as well. The DermaSweep is our new microskin resurfacing machine. It's very good because it does microdermabrasion like the old machine, although it has a different tip, but it allows the delivery of active ingredients such as a peel or hyaluronic acid to make your skin look a little bit plump if you have an event coming up. And so it does that at the same time. So it basically infuses your skin while it exfoliates the outer layer. So you're doing two things at the same time. So it's much more effective. We also have two brand new lasers that we're very excited about. One is the Soprano, shown at the bottom. It's basically the only painless laser hair removal machine out there, and it works very, very well. It also has a skin tightening component, and this has been very popular. Sure.
How permanent is it?
Well, you need at least 6 treatments, if not more, depending on your hair type. And they have to be spaced out appropriately. It's not 100% permanent. You will need touch-ups, let's say every year or so, depending on your skin. Once you get to that point where you've had your initial 6 treatments and you're at that phase, you just have to anticipate that every year you may need touch-ups. And then the top one is called the Harmony. It's a laser that actually has 3 different heads on it, and it does 3 different, actually more than 3 different things. It has a pixel system, which is a skin tightening and pigment improving piece. It has an erbium that also helps with spider veins, and it also has a laser hair removal component on it and an IPL, right? So it does all of those things all in one laser, and you can have any range of treatments with one appointment or schedule them out. If anybody's interested in these, we also have more information in those brochures. I just wanted to say that we have these because we're very excited to have them in our armamentarium. We also have Mandy, and I'm so glad that she's here, and I hope you don't mind. I took these pictures at the bottom from your website, but I didn't have any since she just began with us, but she does really beautiful natural work, and you can see the bottom right, the lower eyeliner that's been treated, and then on the left is the brow, right? So she does really beautiful work, and we're very, very excited. And so the next component of anti-aging remedies are carried out by, at least in our practice, they're only carried out by MDs. So injectables in our hands are only done by MDs, not nurses, not anybody else. And what can we use injectables? By injectable, I mean anything that you literally inject, so Botox, fillers, etc. You can prevent and treat motion-related wrinkles. You can correct superficial and deeper wrinkles that are not motion-related. You can add volume. You can delay or prevent surgery. And these are the areas shown in red are the areas that we can treat effectively with Botox. And mostly it's around the upper face, so crow's feet on the sides of the eyes, the glabella, which are these 11 lines, the forehead, these little bunny lines that can form at the top of your nose. You can also treat what we call Montalis strain, which is as you age, you lose volume in your chin, and so you get this puckering effect. Well, you can treat that. You can also treat the upper lip lines and a variety of other things. The blue are areas where you can add filler, although you can certainly add lots of filler to the cheeks and other areas. So these are the 11s. Some people are lucky and only have one, some have 11s, and some are very unlucky and have 111s. But these are the glabellar furrows that we treat very readily with Botox. We also treat the forehead and also the crow's feet that I've showed you. And these are just some representative pictures. You can see at day 14, Botox takes 3 to 7 days to take effect. It lasts about 4 months. It's a great agent. It's been around for a long, long time. It was originally developed for spastic muscle spasms, and it was originally used by ophthalmologists for blepharospasm as well as by neurologists. So it's really a well-tried agent. We can use it in men very effectively as well as in women, although men have thicker muscles and typically require higher dosages. These are some of the areas where we can use fillers, volumizers, and we have several areas where fillers can help. The hyaluronic acids are the ones you're probably familiar with. Juvederm, Restylane are the most commonly used. Hyaluronic acid is naturally present in your body. These are just made from bacteria. They don't have any allergic reaction potentials or any of those things. And they're usually used in nasolabial folds, which are these areas, under eye circles, so here, just to camouflage a little bit of that area where you get that trough and that kind of shadowing that makes you look tired. You can use it in the lips. You can use it in this area. Just as you start to form a jowl, you can actually use it to fill in these lines and also camouflage that differential. We also have something called Radiesse, which is a different agent that's calcium-based, and that's a really volumizing agent that's not good so much for fine lines and wrinkles. So we use it in the cheeks to really augment that volume instead of fat. We use it in the chin. Since you lose volume there, you can use it here at the base of the nose, various areas. Sculptra is another agent. I don't particularly use it very commonly in my practice just because I don't have that many patients who are good candidates. It's really good for areas such as the temples, or if you have a person who's really, really thin and has lost volume globally, not in a defined area. That's when it's really good. It can also be used in the hands, although I prefer Radiesse for the hands. These are just some pictures of befores and afters using Juvederm to the nasolabial folds. You can see how much softer these patients are on the right than on the left, but still looking natural and not looking like they have no lines. This is actually one of our patients. When these two agents came out, I wanted to compare the two and decide by myself which of them I preferred. So here she is before injection. Immediately after, and you're going to have a little redness, a little bruising, that's common. And then here she is before treatment and 7 months after. And you can see that on her left nasolabial fold was maintained much better than her right at 7 months. And that's actually Juvederm, and that has been, since this study was done, that has been shown by other people to last longer than Restylane. So I preferentially use Juvederm in those spots, but I use Restylane under the eyes. You can also use injectables such as Radiesse to improve the volume loss that happens in the back of the hands. Everybody takes care of their face, sometimes their neck, not their décolletage as well as they should, but the hands get forgotten. But recently there's been a resurgence in this. And actually the last patient I treated, her husband said to her, "But your hands look so bad." And she had already had her face done, and so she hadn't even noticed it, but for him it was something that he really focused on, and I treated her with Radiesse, and she did great, and they're both very happy. This is somebody who had a combination of procedures. So he had his upper lids done, just a little bit of extra skin taken off. You can see how he's really struggling here to keep his eyelids fully open, especially on the right. So this is corrected here on the side. He also had Botox to the brow, allowing smoothing. And you can see how deep his furrows were on the right and how much smoother he is on on my right. On your right, he's much more smooth, and he also had these, his lower lids, or these nasojugal grooves, these tear troughs filled with a little bit of filler, and that's why he looks so much more smooth, and those hollowed areas are now filled in, and those shadows now have gone, because people think that they have dark shadows because they think that their skin is stained. Well, that's not it. It's because you've lost volume, so now all the blood vessels become more apparent. So what you need to do is put some distance between those vessels and the skin so that it's not so translucent. This is, to answer your question, this is a woman who had fat grafting to the face. She had had a facelift, but as you can see, that doesn't restore the volume of her face, and it also doesn't restore the nasolabial folds, because the facelifts don't really do that. You're not addressing that part of the face. And her son was getting married, and she came to me, I just want to look good for the wedding. And I tried to talk her out of it. I said, it's going to go away. You're 80. You know, she's 80, and I mean, she looks great, but she's 80. And I said, it's not going to stay. And she said, I just want it to stay enough for the wedding. I understand. Because you can't get this kind of volume with a filler unless you put, 20 syringes of fillers, and that's a lot of money and a lot of time, etc. So she was very happy, and of course it did go away, but she was okay with that because we had discussed it ahead of time. And that's why you have to be really honest with your patients and about your treatments and know what you're doing. What's new in injectables at Penn Plastic Surgery? Couple of things. Dysport is a different company as Botox. We just started using it. It's the same company that makes Restylane. It has a slightly different treatment profile. It takes action a little bit earlier, so 24 hours to 3 days as opposed to 3 to 7 days. So for people who want their efficacy to come about earlier, they have a party, they have something coming up, we'll use Botox. It also has a different diffusion profile. And so it diffuses a little bit more broadly, and so what happens is that the effect is, I would say, a little bit more subtle. And so for people who want a more natural look, I would preferentially use Dysport. But the problem we have is that everybody knows the name Botox, and so a lot of people are really reluctant to try something that's not Botox. So the company's been very good, and that's why I put combination specials up there to remind myself. Company's been very good recognizing that Botox is such a trade name that they've now introduced rebates to the patient. So if you were a prior Botox patient, they'll give you $100 to try Dysport. So you basically get a rebate from your Dysport treatment. The price for the treatments is the same. The two agents are, at least in our practice, the same price. There's also a new Botox that's going to come out, and I should call these Neuro Modulators, but nobody knows what that means, but that's really the official term for these. That's going to probably come out in the next couple of months, and because we're such a busy practice, this is the company that actually produces Radial. I don't know anything about it other than it was just FDA approved, and it's going to be for cosmetic purposes. It's been used for reconstructive purposes for a long time, but it's going to be introduced in the next month or two, and we're going to be among the first to have access to it. Laser skin resurfacing, what can we do? There's a fractional CO2 laser that we have in the office. I also use it on all my facelift patients at the time of their facelift because I think it rejuvenates the skin so nicely, tightens the skin, helps with mild wrinkles, builds collagen, and if you have hyperpigmented spots, it helps with those as well. There is a 1 to 2 week downtime. You're a little bit red. You're not desquamated or raw like you were with the old CO2 laser. And some patients, I would say the ones who are the most fair skinned, take the longest to recover, surprisingly. We also have a V-beam laser, which is a vascular beam. It's good for spider veins on the face and body, and we use that quite frequently. And then surgery, what kind of things do we do in terms of rejuvenating the face and the body? Once you've kind of exhausted your options, skincare, injectables, and laser, you're not a candidate for those. And I have patients who come in and they're really not candidates for those because, like that woman, I would have had to have put 20 syringes of fillers and you're still not going to get the same results. So I basically tell them that really their best option is surgery, and you just have to be honest. And on the face, we do brow lifts, we do upper and lower lid lifts, neck lifts, face lifts, rhinoplasties, chin augmentation. I left that out. That's done very commonly with a facelift because you lose your chin volume. So you can either do that with an implant or you can just advance the bone a little bit. In terms of the body, breast augmentation, especially after breastfeeding, is very common, or immediately before going to college or immediately after college. When you have these sort of life breaks is when people tend to want to do these kinds of procedures. Breast lift, very common after breastfeeding. Tummy tucks, very common after childbearing. And the combination of the tummy tuck or the abdominoplasty with one of these two is what we call mommy makeover. So when you hear that term, that's what that is. Liposuction, very, very common. You can treat the arms, the abdomen, the flanks, the back, the thighs, etc. Arm lift, thigh lift. And what's new in surgical rejuvenation? Well, more subtle natural approaches are much more common now. Nobody wants to look done. Integration with our skincare team. We have specific skincare regimens that we put people on. Safer, lighter anesthesia that has fewer side effects, no nausea, no vomiting, as we used to have a lot of faster, easier recovery because of the way that we do things. For our patients who are safe enough to stay overnight at the hotel, they'll stay with a private nurse. And then because we have access to the newest clinical trials and interventions, our patients are offered those. And then this is the last kind of information I have is what I call youth through the ages, starting from the teens. This is really when you have to take care of your acne so you don't get scarring and hyperpigmentation. Kids at this age also consider laser hair removal prior to going to college, and then you really have to establish healthy habits at this point. Take care of your skin, protect from the sun. In your 20s is when you really have to amp up the regimen, incorporate vitamins and alpha hydroxy acids. And then this is a very common time for rhinoplasty, breast augmentations, and liposuctions, either before or after college. The 30s is when you really have to intensify your skincare, start your Retin-A, start your peels. Depending on what your face anatomy is, you may or may not be a candidate for Botox and fillers. A lot of patients start, I would say, in their mid-30s to get those kinds of interventions. And then 40s is really when you want to focus on the eyes because that's the earliest sign of aging. It's time to consider either filler to the eye or an eyelid lift if you have extra skin. And then as you go into your 50s, that's the most common time for surgical rejuvenation of the face. And then 60s, if you've already had, let's say, a facelift or other treatments, that's when you have to start maintaining it because your face continues to age or your body continues to age. And if you've invested in this tremendous intervention, then you really need to maintain it.